So in the guideline we currently mention the CX bladder test, which is not available in Europe yet, the expert bladder cancer test, the ADX bladder cancer test and the APCheck test. What's not mentioned in the guideline is the Euromonitor test, which is available in Europe. And again, if you look at the latest literature, the negative predictive value of those tests is all very, very high. Meaning that if you do the test and it's negative, you can be very sure that there is no recurrence. And that's both for lower grade and also higher grade tumors. For higher grade tumors, the negative predictive value is close to 100%. And for lower risk tumors, it is, let's say, 90 to 95%. And again, if you miss a low grade tumor, I wouldn't be too worried about that. I do active surveillance in those tumors. And there are some differences in specificity, so in the positive predictive value or the false positives. Remember that if the test is false positive, that patient would have had a cystoscopy anyway. So basically that's not the worst thing that can happen. But you're right, if you look at the last major review that has been done on markers, all 5 markers I mentioned, you see that the number of false positives is between 10 and 30% depending on the marker. So yes, indeed, of course you will have, if you have a very high negative predictive value, you will have more false positives. But again, those patients would have had a cystoscopy anyway.